Hello and welcome to our Psych Congress video roundtable. We'll be talking about hot issues in schizophrenia. Joining me today are Doctors John Kane and Jonathan Meyer. Welcome.
Thanks very much.
Thanks for having me, Les. Really appreciate it.
Dr. Meyer, tell us a little bit about COVID-19 and the pandemic. How did it affect prescribing and adherence?
Well, as Dr. Kane really mentioned, one of the main ways we can minimize non-adherence is use of a long-acting injectable. So some investigators actually surveyed people in November, December of 2020 about how COVID impacted their LAI prescribing, and they presented this data at Psych Congress just recently. So this was a survey of over 400 healthcare providers, mostly physicians, but again, psychiatric nurse practitioners, PAs as well. End of 2020, many of them said, COVID-19 did not change their prescribing trends too much. They were still able to get people LAI treatment, but they did acknowledge that were barriers. Sometimes there wasn't staff, the clinic was closed. Patients occasionally had trouble with transportation. But their expectation was overall that they might be able to give more in 2021. And they really noted the fact that, particularly because many people really do not want to go to a hospital during this era of COVID, they found the discussion perhaps a little bit easier, assuming they could work out some of the procedural issues about getting patient and medication in the same room. The underlying hypothesis always is that if we can give people continuous medication, they don't have to struggle with oral adherence issues. And this is common to all chronic illnesses, as was alluded to by Dr. Kane. Go to the hypertension clinic, you go to the diabetes clinic, it's the same issue. Oral non-adherence in a chronic illness is about 50%, and it's no different for schizophrenia. But if we can get people on long-acting injectable therapy, we really feel like we can mitigate this. And in this survey, 43% of the providers said they expected their long-acting injectable use to increase in 2021. And they talked about the fact that now people are vaccinated, staff is often in the clinic, patients themselves have been vaccinated, they feel more comfortable about traveling. They think that it's really an opportunity to have a discussion in a way that may have been difficult in the past about how can we keep you from relapsing? How can we offer you options which may be convenient? And I think that's part of the discussion with LAIs is one of convenience. It's not a punishment, it's convenient. You can get an injection every 1 month, 2 months, 3 months, 6 months. It'll mitigate relapse, not reduce it to zero, but certainly lessen the chances, mitigate non-adherence, and thereby keep you from perhaps having to go to the hospital with all the concerns that may be involving. Even now, even among vaccinated people, there's still a concern about being out in public and exposure to COVID.
You know what? Some of our communities near where I live decided to no longer be open even for injections. This was especially so at the beginning of the public health emergency. And they essentially told their patients, I'm going to send an e-prescription to the pharmacy for the oral equivalent of what you've been getting as an injection. And that's what we're going to do. Unfortunately, it didn't work out all that great. People were placed initially on the long-acting injectable, or they elected to receive the long-acting injectable, I should say it that way, for a good reason. And so this was a disaster for many people. We actually did in our community ourselves, we kept open the injection clinic, so to speak, and actually used it as an opportunity to switch people over from the every 2-week injectables to the every month injectable, or to the every 2-month or every 3-month. And that actually made a lot of sense for many of our patients. So this also was an opportunity for us for more rational care.
I agree. And again, as Dr. Kane was alluding to, sometimes we forget that many people may elect to use an LAI just for the sake of convenience. It's convenient in terms of I don't have to worry about the pharmacy mailing a prescription or going to pick it up, plus the convenience, as he mentioned, of not having to wrestle with that daily decision making of should I or shouldn't I, or they just have cognitive issues, they forget, they forget and then they suffer the consequences. Giving them an LAI option maybe liberates them from a lot of those concerns.
And also not having the family dynamic that sometimes evolves when family is concerned about adherence, and the patient is can get annoyed about the family being nudging them or whatever. And so, we can eliminate that with a long-acting injectable. I also hope that someday there'll be more opportunity to give these injections as part of a home visit that would alleviate some of the burden for travel and things like that. And if we can avoid, 1 or 2 days in the hospital, that relieves a lot of financial burden that could hopefully be used to support some of these options.